So it's my great pleasure to introduce a woman who's been a real leader in the field, and I'm proud to call a colleague of mine, and that's Dr. Barrie Cassileth, who I think all of you know is the chief of the Integrative Medicine Service and the Lawrence Rockefeller Chair in Integrative Medicine at the Memorial Sloan Kettering Cancer Center in New York. Barrie has been a real scientific pioneer in the assessment of complementary and alternative medicine in cancer patients and running the sort of large-scale clinical trials and studies to determine that some alternative treatments are in fact safe and appropriate and some are not. And has also worked very hard at Sloan Kettering to develop special compendia of herbal products and other supplementary medicines and their safety and value and profiles. So she's been a remarkable leader in this field. Much of her work led to the founding of the National Institute and the Office of Alternative and Complementary Medicine at NIH. She's written and published several books in this field and has been a tremendous pioneer. And she's a lovely person too. So please welcome Barrie Cassileth.
Thank you, Cheryl, and hello, everyone. I'm delighted to be here. I think this is a wonderful program. I've learned a great deal, and I love the mix of the basic science behind this, the mechanisms behind which lie what we do every day in trying to work with patients, and that's what I'm going to talk with you about. So I'm going to try and give you a very brief overview so that we have more time for questions than is usually the case. I think there are more questions than words to be said on my end. This is the outline of what I'd like to describe. We have a program at Memorial Sloan Kettering Cancer Center. It's a small department. As departments at Sloan Kettering go, we're probably one of the smallest, although there are 60 of us. And I'd like to outline the topics that I'll cover briefly. First, an introduction and background to music as therapy. Secondly, an overview of our music therapy activity. Third, inpatient, outpatient, pediatric, and staff activity, outreach, clinical programs, education and training, promoting music therapy and its importance in the oncology setting. I think each of these will give us a little bit of information and something that we can discuss further as time goes on. So the formal discipline of music therapy, particularly in the United States, developed in the 1940s, as you heard earlier, with the granting of degrees. It was initiated, however, by the use of music therapy with disabled soldiers in VA hospitals when it became clear that it had some benefit. So today, music therapists work in clinical settings throughout the world. It's used as a complementary therapy, complementary meaning adjunctive therapy, for many diseases and in a wide variety of clinical settings, including hospitals, rehab centers, nursing homes, and so on, as you've heard in terms of the research activity. But music as therapy has many roots, and they're much deeper than the ones I just described. The ancient roots of music therapy are fascinating to me, and I wanted to share them with you. Early Egyptian tomb paintings display musicians accompanying the deceased to enhance their afterlife. And Greek thinkers such as Aristotle and Pythagoras believed that music could facilitate healing. Singing is intrinsic, as you all know, to Native American healing rituals that are hundreds of years old. And incantations and chants are part of shamanic traditions worldwide in every culture and are included in the oldest references to medical practices. What's particularly interesting to me, and has been for a long time, is the confluence of music and medicine. So Apollo, the Greek god of Olympus and son of Jupiter, was also the god of medicine and music simultaneously, because the two were almost one and the same. And then more into recent times, that is the 18th century, we see from The Art of Preserving Health by John Armstrong a quote, "Music exalts each joy, allays each grief, expels diseases, softens every pain, subdues the rage of poison and the plague." So I'm going to tell you a little bit about how music therapy subdues the rage of the poison and the plague known as cancer. The music therapy program is a very vital, crucial part of our program at Sloan Kettering in integrative medicine, and it has been since the very outset, which was in 1999. So we're now 13 years old. And just to show you the organization of our program, we are like every other academic department in any medical center. We have inpatient and outpatient clinical services, research, education and training, and the information program that Cheryl alluded to, which is a free website, part of the Memorial Sloan Kettering website called About Herbs, that has information on over, I don't know, a couple hundred, 260 things that include music therapy, but cross the boundaries into all kinds of dietary supplements, unproven methods, and so on. So our integrative oncology program, our department, has broad programs in each of the following categories to meet the range of clinical needs. Patients need all of these things: fitness, physical activity and nutrition, information about herbs and dietary supplements, because most of them are precluded when patients are on active treatment, acupuncture treatment, massage therapies, mind-body therapies, and certainly not least, but music therapy. So we're going to begin with music therapy to talk about the program that we have in place, which serves as an international model. And we see across the board for all of these therapies, not just for music therapy, more than 20,000 patients and family visits on an annual basis. So it's a fairly substantial program. And music is a vital part of it. Here are some examples of symptoms that are treatable with integrative therapies. These are just examples: pain, fatigue, anxiety, stress and panic. Those which are marked with red bullets indicate those interventions that are particularly useful, but not the only ones that are particularly useful in music therapy. And other symptoms that are controlled with other integrative modalities include hot flashes, sexual dysfunction, xerostomia, which is extreme dry mouth, muscle weaknesses and poor balance, urinary problems, and on and on. And we can talk at the end, because we will have time for conversation and questions, about anything that you would want to pursue in greater depth. So here's an overview of our music therapy program. We reach patients and families of all ages to address their physical, emotional, psychological, and spiritual needs. And our major goals in every case are to ease fear and anxiety, enhance expression and quality of life, help manage symptoms, and promote relaxation and comfort. Our therapists see about 2,400 individual inpatients each year, and also provide numerous group sessions, which I'll tell you about. The type of music and instruments used are based on individual preferences and needs at each intervention. And the interventions include all the things that you know about: songs, improvised music, music-assisted relaxation, receptive listening, and so on. We have a cart that we haul around the hospital that contains a wide range of instruments: guitar, keyboard, harp, percussion, and other instruments, and we bring those to the patient's bedside. We see primarily, if not exclusively, but primarily inpatients rather than outpatients, although I'll show you some examples of outpatient interactions as well. Our music therapy team is probably larger than most. We are very fortunate. We have 8 music therapists this year. We have 4 senior music therapists, one of whom is going to give a presentation after mine. And this year we are fortunate to have 4 music therapy interns who are graduates of music therapy programs and doing their internships with us. So this gives us 8 people to spread around a hospital that sees, on an outpatient basis, 2,500 patients every day, 6 days a week, all with cancer. We work with patients in all settings, including ICUs and isolation units. Music therapy benefits are vast. Music therapy provides gentle stimulation for patients who are being weaned off sedative medications. It can lower blood pressure enough to forego additional medication. It relaxes patients, even children, during extubation, which is the removal of tubes from the throat. It reduces patient agitation and distressed mood and calms them during end-of-life care. And because family members often play or sing along or otherwise participate in sessions with patients, music therapy offers families another way to participate in the care of their loved ones, as well as something that helps them in the process. So our inpatient music therapy involves primarily bedside sessions, and these are especially important for patients who are in extended isolation, such as patients in bone marrow transplant units or intensive care units. Our randomized study, which we published some years ago, showed that music therapy reduced bone marrow cancer patients' tension, pain, and distress. We have weekly group sessions for ambulatory adult inpatients. There are not many inpatients at Sloan Kettering who are ambulatory, but those who are can go up to the 15th floor of the main building, where we have something resembling a recreation room, and we have drum circles, sing-alongs, musical meditation, and support and communication, which are all very important and also contribute to the overall benefit of group and as well as individual music therapy. We also, on an inpatient basis, provide a lot of end-of-life comfort care. As staff and family note often tell us, the soothing, familiar music assists loved ones to care for the patient and to say goodbye. Attaining a sense of peace and calm is extremely difficult in these times. It's a very high-tension experience for most, with a lot of uncertainty and a lot of depression and difficulty, and it's very much needed at this time. Music therapy helps with all of these problems. We also have an environmental music therapy activity, and this is provided in the PACU, the post-anesthesia care unit, the hematology chemotherapy suites, the pre-surgery unit, and in other areas of the hospital. So we know and we see every day that music powerfully influences the hospital environment as patients and staff all struggle together with the many stressors around them. Our music therapy for outpatients and pediatrics, I think, is quite special. We do what we can, usually with harp and acoustic guitar, because they like it very much. Using these instruments and sometimes others in waiting areas for patients who are waiting to get into their adult chemotherapy group and the same-day surgery units. And in pediatrics, we have a very large group of pediatric cancer patients at Sloan Kettering, and we do a lot of work with them, with everyone from infants to teenagers. We have a weekly music and dance program that encourages creativity and encourages expression, and this is very helpful because it eases their fears and in not only the children but in the family members as they await outpatient appointments. We provide bedside music therapy for pediatric bone marrow transplant patients, which is a special group in special need, and we do our best to take care of them. We also try to be helpful to staff. We have a caregiver respite hour for ICU staff, and they claim that it helps them a lot, calms them down, gives them a few moments of peace and quiet, and helps them deal with the stressors that most of these professionals face on an hour-by-hour, minute-by-minute basis. And along with the chaplaincy and nursing groups, we provide something called Refresh and Renew. These are sessions for inpatient nurses and ancillary inpatient staff. And we have music, meditation, and supportive discussion, and this, again, helps reduce stress. So it's not only patients that are in need, it's also staff, it's the physicians, the nurses, and everyone else who takes care of the patients, and it is most certainly the cancer patients' families. Our outreach clinical programs include regular music therapy, which we give in local centers such as Gilda's Club in New York and the American Cancer Society's Hope Lodge, which is a residential facility. It's a high-rise near Penn Station in Manhattan, where people who do not live in the area can stay free. And we get many patients from all over the world who can't afford to stay in a hotel, and they're put up thanks to the American Cancer Society's Hope Lodge, which exists in many different cities. The one in New York is pretty spectacular. It's a very lovely building with a lot of communal activities. So our efforts try very hard to contribute to the staff and patients of these important institutions because they provide continuing support for cancer survivors. Our education and training activities are broad, just in music therapy. Annually, 3 or 4 of our, we hopefully have 4 graduate students in music therapy. It depends on whether we have the funds to support them. This year we have 4, and I think we'll be able to have 4 this coming year as well. But annually, our music therapy graduate student interns, when they are finished with their program, they join us for clinical training, and then we select the top students from various graduate programs to fill our internship slots. And these students are with us for most of the year, and they observe and assist senior therapists before they're permitted to work with patients under supervision, and then eventually, in fairly short order, they may work on their own. And as the culminating event toward conclusion of their internship with us at Sloan Kettering, our graduate students, that is our music therapy graduate students, present at our integrative medicine grand rounds. And this is an important occasion for all of us, which we all enjoy very much. Following a 2-day course that we had previously for music therapists in music therapy for the palliative care patient, that is, this is a kind of a postgraduate course to teach music therapists how to work with patients who are terminally ill. We're preparing now a more in-depth Memorial Sloan Kettering certificate training program called Music Therapy for the Cancer Patient. And this is going to be open to those who've completed music therapy graduate training and completed an internship, not necessarily with us, but an internship somewhere. And it's going to include extensive internet training in dealing with cancer patients at all clinical stages and at all ages and so on, and with all cancer diagnoses. And that will be followed by 2 to 3 weeks of on-site clinical observation and training. Our education and training has involved a lot of people from a lot of parts of the world, and these little red dots are places where people have come to learn from us, and we're pleased to have this outreach because we want to spread the field, not only of music therapy, but of integrative medicine in general. So we do a lot to promote music therapy and its importance in oncology, where I think it is absolutely crucial. Our program was featured on CBS the early morning show very recently, and our next presenter, who is here and ready to go, is going to show you a brief video of that, plus some other videos of work with people on an inpatient setting. Our presentations at various cancer conferences always include an emphasis on music therapy, so we try to educate oncology professionals and others who attend these conferences to the importance of music therapy and its value. Recently, Karen Popkin, who's the manager of our music therapy program, presented at the inaugural grand rounds of the new Olivia Newton-John Cancer Center in Melbourne, Australia. That was just a couple of weeks ago. But we do a lot of this kind of thing, and spreading the word is something that I think we all need to do, and we're very happy to participate in that. Another bit of education is my book, which is out there for sale at a reduced price, Complete Guide to Complementary Therapies in Cancer Care, and has an extensive chapter on music therapy. So from all of us in the Integrative Medicine Department, that's our little building, it's an old bank. You're welcome to visit if you're ever in New York, call and make an appointment. There are about 60 of us. This is not everyone, but most of us, and we all send greetings, and I thank you very much. I'm happy to take any questions.
So Barry not only caught us up, we have some time for questions. Questions for Dr. Cassileth, please.
So I've gone around the world, mainly India, and worked in some programs, treatment programs. Got a little bit of information from Bob Royer in California about what she's doing. But out of the resources that you have in your program, what could I, as a music therapist, kind of look at and possibly make some suggestions to the different programs, the different hospitals in India and the docs over there, and they have, some really good yoga therapists that I was utilizing, kind of at a distance for relaxation and things like this. But do you have like set programs and protocols, that you're using that I could check out, and which resource would that be?
In music therapy?
Yes, ma'am.
Not really, because music therapy is, first of all, most of our music therapy, as I showed you, is with inpatients, and inpatients vary tremendously. They are all ages, they are all cancer diagnoses, they are at all stages of disease. They are with family or without family. They may not speak English. In fact, we have patients from all over the world, and many of them don't speak English. And with music therapy, that doesn't matter terribly, so that works out all right. But the protocols that we use are really determined by our very smart, knowledgeable music therapists at the bedside in talking with the patient and family and reading the chart in advance. Of course, it's necessary. You read the patient's chart to find out what's going on. Sure. So by the time you get there in that room, you have some idea of what the needs might be. But we try very hard to have special sessions that meet the needs of individual patients. And you'll see in the next presentation how varied that can be with use of singing or humming or listening or just playing. It's very dependent on the patient and family and their needs, their culture, and their interests.
How about specifically with the relaxation situation where someone's getting chemo? Are there any set protocols with different kinds of recordings and things that you could do as a set protocol? Or, I'm a music therapist. I know everybody's different, and you have to specify. But yeah. Are there any things like that?
In the group areas, the waiting areas for adults, for example, we try to play simple classical music and other music that is generally not offensive. And we frequently will ask patients afterwards, and we'll always get one or two people who will say, oh, that was really boring. But on the other hand, we can't go in and play something that's very jazzed up or very metallic or whatever it's called music. Because I think that most people, maybe a few would like that, but most would not react positively. Thanks.
Yeah, in addition to reducing stress and pain and improving quality of life of cancer patients, is music therapy being used to actually help in the treatment of the cancer, to actually help improve the efficacy of the cancer therapies themselves, halt the progress of the disease? Any work being done there?
Well, it's an interesting question, and I can tell you that music therapy and the other complementary or integrative modalities that we employ frequently enable patients to get through treatment, which will have a major benefit for them physiologically. But neither music therapy nor any of the other therapies that we offer treat cancer. And there are people who promote acupuncture, massage therapy, and other integrative modalities as actual treatments. But that's called quackery. Unfortunately, we wish we could cure cancer with music therapy or with acupuncture or any of the other things that we use. The closest we can come, it has to do with fitness. And that brings us back to something I said earlier about music. Not so much for critically ill patients who can barely move, but for those who can take a more active involvement, the physical activity involved in singing, in playing, and in the motion that automatically comes to human beings when they are engaged in music has its own benefits. and may contribute in some way to survival. We know that physical activity per se has a very strong relationship with survival for certain cancers. Specifically studied, breast cancer, lung cancer, and colorectal cancers, probably may be true for other solid tumors as well. So in an indirect way, and sometimes in a more direct way, music therapy is extremely valuable. Thanks.
I'm wondering to what extent your music therapists work with recordings versus live music, working live with singing and with performing music with your patients, and what, if any, significant difference you see between using recordings or a live musician interacting with the patients.
We don't use recordings. This is all live because it's all specific to that human being sitting there and that person's family and their needs, and we engage them, as you will see in the next presentation, in the playing itself. So music is wonderful. We all love music, but it's not music therapy. Music therapy is a very different matter. It requires clinical knowledge, it requires understanding, in our case, of oncology, of what it means when this patient is just coming out of surgery and that patient is just going in for chemotherapy, and on and on. We have to deal with the patient's capacity and the patient's needs, and that can only be done the way any practitioner, any oncologist, for example, interacts with a patient. It's very difficult to go by a rule book because it's too sensitive to the individual needs.
So Barrie, I had a question. I found it interesting among the instruments that your therapists use in our center. Our program's certainly not as well developed as yours, but our patients in the chemo suite or the waiting areas have strong positive reactions to harp and acoustic guitar as the instruments that seem to be preferred. Or some of our Native American practitioners will use a flute or drum. And that seems, is it just that those are portable and easier, or do you think there's a resonance about those particular instruments that make them more therapeutic or soothing in some way?
I think that anything that's intrinsic to a culture is going to do better than things that are not. But I can tell you that in New York, even though we have people from many different parts of the world who speak many different languages, we tend to use guitar more than anything else for group activities, in large part not only because it's kind of like nobody doesn't love guitar music, but it's also because of the way the outpatient areas are structured. If you imagine a space a little larger than this room, but broken up into little sections so that it's a little more comfortable for patients. And patients and families sit in an area which would hold maybe 6 people on average or 8 people. We don't want to blare it out for the whole room. So we want to have musical instruments that are consistent with that kind of an outpatient setting. If we had a different physical structure to the outpatient setting, we might do it a little bit differently. But yes, the guitar, and as you'll see in Holly Menzer's presentation next, are both very popular. Thank you.